Okay, we're live.
We're live right now. Okay, so hi, Dr. Ellstrom.
Hi, how are you, Kerry?
I'm doing well.
Ready to kick it?
Oh, Dr. McNeill, thank you
nice
so
of you
much
to join
for joining us. Actually,
Yay.
I just walked to the back and Dr. McNeill was still with a patient. Like literally, it was 5:28, and I was like, I told her medical assistant, Lauren, thank you, Lauren, for getting her out the door. And then the patient scooched out the back.
I planned it perfectly.
Perfectly.
I planned it just like this.
Yeah.
Make the most of my time.
It's very thoughtful. It's perfect.
Okay.
So anyway, we're here. We're kicking it in the office tonight. I've got Dr. Ellstrom and Dr. McNeill. Please do. Let's just be real here. I'm going to scratch my ear, make sure I got a little tickle right there. Anyway, we're going to be talking tonight about common problems or concerns that people come in and either they're looking for a dermatologic solution or a plastic solution. Sometimes they have something in their mind. Actually, what caused me to think of this was a particular patient that came in. I haven't been doing consults, say hide me in the back, and I usually am like, typing on my computer, but they were short-handed, or the person who normally does cool sculpting wasn't available, so they asked if I could do it. Of course I can, because I can do almost anything. And so I went back to talk to the patient, and she presented with, she wanted to have True Sculpt Flex, which is our muscle building treatment that we have. It's good to help define muscles, but she really wasn't a candidate for True Sculpt. She had a little excess tissue, and if you're watching and you know who you are, and this picture is not you, and this is not what you presented with, but this is an example of what could be. Okay, so Dr. Ellstrom and Dr. McNeill have not seen this, so this is going to be our battle round number one. Okay, there are solutions on both the derm side as well as the plastic side. Oh, I'll give this to my camera woman.
Trusty
and we're going to discuss, how one might tackle an abdomen like this, okay? The patient says, hey, I want to have a bikini-ready stomach, okay? So let's start with ladies first.
Okay.
Okay, ladies first. Dr. McNeill, let's talk about what the derm solution might be for this problem area. It's not a problem because, girl, she looked good, but...
She looks good. I
agree.
agree.
Looks good.
She's pointing to her love handles, assuming she doesn't like them. She could certainly treat her love handles with cool sculpting. Cool sculpting freezes fat, so would reduce the fat in that area and reduce that, little part that's hanging over her jeans. She could also do cool sculpting all along the sides. She could also do it, sort of around the belly button and along this part below the belly button. And she would get a very, very nice improvement. Would her waistline be like going in and coming back out here? No. So we'd have to have a realistic expectation, discussion of expectations with the patient. But could she do cool sculpting, a procedure with no anesthesia, no downtime at all? She walks in, lays there and watches TV and then goes home. No scars, almost no risk. She could do that and get a very, very nice improvement.
Okay, so you were kind of touting, and maybe I've sensed a little bit of a, I won't say dig, but little bit like, okay, this is why this is better.
Sometimes there's scars from plastic surgery.
There's no downtime with cool sculpting. There's no scars. There's no anesthesia, right? And she will get a much improved.
Contour.
Let's talk about cost. Like, where would we be in the realm? How many treatments do you think it would take to get rid of those love handles? And then when I see this, I'm kind of not just the love handles, but also the abdomen. So let's kind of just touch on cost and number of treatments.
That's a good point. To give this patient a noticeable improvement where you really don't see this pouch if she's, sort of wearing a tight shirt. It's going to be probably $9,000 for cool sculpting.
But again, no downtime. She comes in at lunch, she gets the treatment, and it's permanent.
And it's a permanent reduction. As long as her weight stays about the same, she will still have that improved contour.
But the number of fat cells in the treated area will go down by 25%, 20 to 25%, correct?
She'll have a permanent reduction in fat cells in that area.
Okay, so now we turn to Dr. Ellstrom, our plastic surgeon, our board-certified plastic surgeon.
So let me take a peek here. So it's difficult to see in the photo, but the big concern I'd have for a patient like this is like, what's her skin quality? Because that really determines, what we can do from a surgical perspective. Has she had prior children or had massive weight loss that has really, stretched some of that skin past its elastic limit? Are there some stretch marks that are hiding under those low resolution shots right there under her jeans? No dig on the photo. So yeah, that's really the most important thing because that can determine what we could do surgically. If there's a lot of skin laxity, then liposuction or cool sculpting may not be like the best option for her because it won't fix the laxity problem. And if we take out some of that volume, some of the laxity can be even more significant or make things look worse. So that'd be the first thing I kind of evaluate with her. If her skin quality was really good, then I could offer her something like liposuction. And so to do that, generally I would make two tiny little 2 or 3 millimeter holes down here and a couple little holes within the belly button, so no scars that you'd really see with clothes on the front, since that was a concern. And then usually I do one kind of hidden around on the back and then 2 in the bra line, and from that I can completely remove all the fat from around the trunk. And doing that, I can give significant contouring. I can take out all the fat in the back, almost all the fat in the stomach. I mean, we leave a little bit just so we can support the skin.
I have a question.
Yes.
So when she obviously has some volume, okay, and I would assume that skin has been taxed, a little bit stretched. Okay, so when you take out with liposuction those little holes, you take out that fat. What happens to that skin? Does it stay tight or?
If it's good skin quality, oftentimes it will recontour back in.
Okay,
so,
she looks young. She looks like she
looks
has
reasonable.
Nice skin.
So I think there's a good chance that a lot of that could come in really well. If there was a concern that maybe there's a little bit of laxity, or maybe she's a little bit older, or maybe she's had like a child but still has good skin quality, then sometimes we can do some other energy-based approaches that can help give you some more skin contraction. The Renuvion device is one I've used a number of times that can help pull in some of that extra skin laxity without having to do a larger excisional procedure. Because that'd be the other alternative, is if there's significant skin laxity that doesn't look like it would retract after liposuction or after a skin tightening thing, then we'd be looking more at a tummy tuck procedure to remove all the skin and fat. And so with that one, the difference, instead of 2 little holes down here and in the belly button, it's kind of a hip-to-hip scar that then goes kind of over the top of where the belly button is. All this gets lifted up and shifted down to recontour all that skin so it sits nice and flat against the abdomen. But that can give you the best shape, and we can really bring in the flanks when we do that as well.
And that's, a beautiful result when you are, when you can hide it with your bathing suit or with your...
Yeah, for me, if you're going to do that, I have to put the scar super low so it sits within the panty line or within a bikini line so that people can't see it. Because otherwise, what's the point of doing it, in my opinion?
So I don't want to give you too much airtime.
Okay, sorry.
But I do want to just say, I was going through pictures, before and after pictures. Of course, it's really hard to get anyone to say that they will allow me to use their picture on the Instagram Live. But what I was noticing as I was going through was there was a few abdominoplasties where there were, and I'm just, I'm going to be just honest. Sometimes when you're a woman and you kind of gain that excess weight and, you can see right here, she's got a little bit of a pooch here, but it doesn't always, she's got the jeans holding that up, but there's also sometimes a little pooch where, your private parts can be sort of covered a little bit with the fat. So I was looking at a couple pictures of your before and afters, and I was astounded by how, yes, the scar is pretty. You did a beautiful job.
Thank you.
It can't be helped. You know, it is what it is. It's going to be a big scar that goes across. It will heal well. And I'm looking at pictures that are just, shortly after surgery. But it's amazing. The before picture, you literally couldn't see the woman's private parts. And then after the surgery, there's, it's flat. And that's amazing. That is amazing. And I think it's something that women need to think about. It might be worthwhile to do that, to go under and to have the scar. But I do want to say, only to be fair, this non-surgical approach, this is an example of a patient. This is like a before and after of a cool sculpting patient. And, no downtime, no incision, and a really dramatic improvement just from cool sculpting. So I felt that maybe I gave Dr. Ellstrom a little more time, but I have the picture here to show the cool sculpting. So I want to be fair. And while we're doing this, everyone, please, one of the advantages of watching us live is that you can ask questions and we will answer them. So I do want to hear from you because you are the ones that kind of guide this conversation. So if you don't have any more questions about the abdominoplasty or the liposuction or, cool sculpting for this issue, we'll move on to the next one, which I'm super excited to talk about. And actually, you know what? I was going to go with the double chin, but because I literally had 4 women tell me that they were going to be watching and that they wanted me to touch on under eye issues, I'm going to go with that one first, just so I don't disappoint, and you guys know who you are. Thank you for watching. I appreciate it.
I think we should just finish up on that and say, in general, a patient like the first one, if there's a broad area that they want to treat, like literally a large surface area that the patient wants fat reduction, cool sculpting is not my first choice. It's best for people with just a little pooch here or, just needs some tightening along the waistline. Then it's very practical. It's a dramatic transformation with, a couple of office visits and really makes a big difference for people. When it is this much, I agree that sometimes, just purely price-wise, and the result might be better with lipo or surgery if the patient's willing to go through the downtime.
I agree wholeheartedly with that, but this is pretty impressive.
It is.
It's very
That's
impressive.
A patient who has
And
a couple little areas.
I too have had cool sculpting done, and I had a really good result, so I'm a fan. Okay, so let's go into the under eye, okay? Because this is a very common, this is a before and after picture, and I don't even know what this woman did. I pulled this from the internet. I don't know what she had done, okay? So since we started with you last time, we're going to start with Dr. Ellstrom. On the before, I'm just going to fold it so that, people can see just not be distracted by the after. So on the before, okay, we're talking about a couple things. The bag, and we're talking about the dark circles and, the fine lines. Mm-hmm. Somebody's asking the cost for lipo and abdominoplasty. That's sort of not your wheelhouse, is it? It's kind of your surgical
it really
coordinator.
depends. Because for those, it's very time dependent.
Don't you hate that answer? It depends. Well, it's so true, though. It really does.
It does. Because, for lipo, we could be doing one little area. We could be going all around the abdomen. They might be, someone who's lower weight. Might be someone who has a lot more fat that we have to take off. So it really is time dependent because it might be something that takes me an hour and a half, or it could be something that takes me 4 or 5 hours. It just, that time is really the biggest variable. And so that's why it tends to be very personalized, to each patient.
So when he says it could take him an hour and a half to 4.5 hours, that not only means the plastic surgeon fees, okay, that would increase, but also the anesthesiologist, the surgery center. So if it's I won't say an easy liposuction, but if it was a short case, it would be much less expensive for those reasons, okay? As the time increases, his fees increase, but also the anesthesiologist. And there's a question, go ahead and say it out loud because I don't understand the stomach issue one.
It says, so they said for stomach and side issue, and then they said if it was the person in the picture coming in to do it, what would the cost be?
Oh. Okay, well, still that's not necessarily fair to Dr. Ellstrom because the surgery center fees do get charged per
15 minutes.
Per 15 minutes. And I don't have that chart memorized.
I don't either.
So I would recommend that you come in for a consultation if you are interested. I mean, I could sort of give a ballpark maybe.
I mean, I think for surgery center, I want to say it's like $1,500 for the first hour, then like $1,200 per additional hour.
So $1,500 approximately. It's $1,500 for the surgery center for the first hour, and then $1,200 for each additional hour. For a person like this who was doing probably an abdominoplasty, you probably do that. And lipo?
Probably abdominoplasty, just because it looks like there's probably some skin redundancy there. But if they had really good skin quality, it might be able to get away with just with liposuction, or maybe like a mini tummy tuck where I just take a little bit of skin at the bottom with some lipo and Renuvion or something if they didn't want a bigger scar. There's lots of options.
So depending on the skin laxity would depend on whether he could do an abdominoplasty or whether it would require or liposuction, which would be a much less invasive, easier, less expensive procedure. So really, we really need to see you. We really do.
You picked a great picture because this is one that could be approached.
Either way.
Yeah, we could get cool sculpting, you could
Go ahead.
get lipo,
Oh,
you
okay.
could get
Thank you.
surgery. It
Thank
really
you.
depends on the patient's goals. And
Yeah, and your budget too, because you could have maybe you say, I would be happy with X improvement, and then lipo might be the right path for you. So it really depends on each patient, and that's why we can customize your treatment to meet your needs. Okay, so I would encourage you to make an appointment with us. Okay. Any other questions on that?
Not right now, no.
That was such a good one. Wasn't that a good talk? We covered all those bases. Okay, now back to this nice, lovely lady here. Okay, so we'll start with Dr. Ellstrom because we started with Dr. McNeill before. So this is your turn. I don't know what she did in this after picture, but
Okay.
what
do I see?
What do you see, Dr. Ellstrom?
Okay, so
Do you want to take it up
we
close?
should bring it up close to the camera. I got it there. So looking at that, I mean, I'm seeing a woman probably in her late 50s, early 60s, kind of limited what you can see, who has a lot of sun damage, a lot of fine lines and wrinkles on her face. She's got extra skin in her upper eyelid that's kind of hanging over the top, and lower eyelid bags that are prominent, along with a deep tear trough deformity.
Yeah, and just I want to.
The tear trough deformity is this groove in here.
The women that we're asking, I want you to address the dark circles first.
Okay.
And then move on to the other issues because there's a lot going on in this picture.
So dark circles it can be kind of a nebulous thing as to what actually is going on. There's generally like 3 different things that can lead to dark circles. It can be fat, like in this patient that's protuberant, just from loss of elasticity over time. So the fat can bulge out, then at overhead lighting, shadowing causes that dark circle appearance. It could also be prominent
I just want to check mine.
Okay, just making sure. It could also be vasculature that's prominent that can kind of give that purple appearance, also make it look dark, or sometimes pigmentation just from the sun, or melasma from hormones or pregnancy can also
And
give
darn
that
genetics too, because some women just have it.
Well, genetics can make you more predisposed to any of those 3 factors, which can cause dark circles. In this case, we can clearly see a bulge of fat that's leaning over the top and giving that shadowed appearance in there. So that's something I generally would address surgically.
Okay, so you speak to the fat there. You're like...
The fat is the problem, along with the skin laxity. So what I would do is actually take this fat and move it into this groove to smooth out the transition. So that instead of a bulge into a groove, you get a kind of a soft curve the whole way down. So you move the fat up here where you don't want it into the area where you do want it.
And I'm assuming that would be an incision at the lash line?
For her, yes, she has a lot of extra skin in here, so I would probably do transcutaneous surgery, meaning like a skin right below the lashes in a natural crease, and then out here, we remove extra skin while we're there to kind of make everything nicely contoured.
And then that would solve the...
It would solve the skin laxity problem, and the dark circles that are caused by shadowing from that fat that's bulging out.
And then when you do that, I'm just curious, could she look sort of sunken in then at that point?
Well, I wouldn't probably be removing fat in her case. I mean, traditionally people would take a lot of fat out, but she's got healthy, fat that's, it's great. It's just not exactly where she wants it. So I'd rather utilize that fat that she has and put it in an area where she doesn't want it, and move it to the area where she does. And
Okay.
Just, it's called fat transposition, just scooting it from here to here.
Okay, and so that procedure would solve pretty much the majority of these problems you're seeing here.
Yeah.
Okay.
And then upper eyelid, we pinch out that extra bit of skin
You just
on top.
you just had to tackle that one too.
Well, I mean, you don't want to have a nice smooth lower lid and have this thing hanging over the top. It wouldn't look proportional.
Right. Okay, so I like that answer. I know probably people are wondering, is that an in-office procedure?
No. That's something that you need to do in the OR. There's a lot of delicate structures around the eyelid, and you just don't want to be awake or moving during that type of thing. You want to make sure you're totally comfortable and not moving while I'm around these delicate structures, because there's muscles around the eye that are down here that you just want to protect and keep safe. So I always do that under general anesthesia.
All right. Dr. McNeill, I'm just going to play the patient. I don't want to do surgery. I'm really nervous. I just want, some improvement. What would we do on the derm side for this issue?
Yeah, this is a patient who might come in and say, I have these dark circles under my eyes, and my daughter or my friend got filler under her eyes, and she had dark circles and it worked great, and so can I get the same? And I would say no, because it wouldn't look good on her at all. If we put some filler in here, it's a mistake I've seen plenty of people do. They put filler in right here, and then it just makes this fat area just swell and look bigger, and it just looks really bad. So putting filler in her under eye would be a big mistake. But there's other things she could do to rejuvenate her eye without surgery. She could do resurfacing. She could do CO2 resurfacing on the upper lid. That would give her some tightening here. She could do it on the low lid. It would help with these little fine lines and these lines out here. I'm red because I just had CO2 under my eyes yesterday. It's a nice procedure for tightening all these fine lines under the eyes and tightening redundant skin on the upper lid. It would not address what I agree is the biggest problem, which is this fat right here. We can't do that with, we don't do injections or cool sculpting under the eye, so fat under the eye has to be addressed surgically.
I didn't pick a good picture, did I?
I know, you kind of threw me under the bus on
I'm
that one.
sorry.
The challenge, I think, is she has really loose skin and a fat pocket that's really bulging. If you do filler in this type of patient, it's a recipe for problems.
So if she didn't have that fat pocket there, could she do filler, and would she see, improvement?
Yeah, when people just have this little hollow here and not excess fat right here, we can kind of soften that hollow or the tear trough, a little indent here, and sometimes even going under here, and it'll just look more smooth, revolumize the area, and then that will lessen the dark discoloration as well, because they'll be it's almost like thickening the skin. You won't see the blood vessels, from underneath.
And then I see this line right here. It's pretty prominent.
That's really just redundant skin. I think this is skin kind of hanging over, so we need to tighten that skin quite a bit. It can tighten a bit with CO2.
We're cutting.
We're cutting. Cut. Sorry.
Or
This nice
Or
lady
both.
that doesn't want surgery. Sorry, you got to do the surgery
But both things actually would be good.
the CO2 and the surgery.
Because her skin quality is not great. And so a laser
I
actually would
hope
help.
she's not watching. She's actually not one of our patients. I literally just pulled it off the internet,
But so her skin quality is not great. And I mean, you could even do a CO2 laser or something ahead of time. So I'll give points to Dr. McNeill on that one, because it'll help improve her skin quality. So when we do a surgical procedure, we could remove less skin and do less of a change from her normal anatomy.
Gotcha. Okay, so and then this is how she ended up. Do you think she did what you were recommending?
I think she just got resurfacing.
Could be.
Just like a laser or peel.
Okay, so it's a market improvement with just the resurfacing. So I'm going to say, if we're keeping score, 1 and 1.
Still has the shadowing though.
Yeah, she still has that.
Since that was the topic.
Yes, that was the topic, and we do have Dr. McNeill's your bright eyes. It's not going to fix this.
It might help, but no, I think she'd be better off with one of these procedures.
Alrighty. Okay. This next one we're going to talk about. Does anybody know anyone that has a double chin?
No, I fixed them all.
You fixed them all. I
With the
know.
cool mini.
I'm going to show a little picture of yours truly. This was a few years back. Okay. Dang, I look good. Okay, so this is the before.
When was that?
I don't know, 2016, I think. Mm-hmm. And then this is the after.
Ooh.
What did I do? We started with you last time, so we'll go to you, Dr. McNeill. This is, and I'm going to show you another picture that's a little, more. This one. So see this nice young lady? And this is men too. If you're one of our male viewers, thank you. We love you for watching. You might have a friend or somebody who has this double chin and you're like, I can help you. I can help you.
So this is a great patient for cool sculpting, or the cool mini. She has a fullness under her chin, but then we have to address what's causing that fullness. Is it lacks skin? Is her skin hanging? Or is it fat that's under her skin that's causing it? And I think it's pretty clear in this case that it's fat. So if it's fat, you can just address the fat, and you can do that sort of non-invasively. There's a couple of ways of doing it. The one we use the most is the cool sculpting, the cool mini. It's little hand pieces that are attached sort of here. We do a variety of places under the chin. You just kind of lay there and watch TV for half an hour or 45 minutes, and then remove the handpiece, and over the next couple months, those fat cells literally just die away, and it's permanent result. So very, very effective for people with fat under the chin. The main thing you're looking for is if it's loose skin or if it's fat. So a lot of people hear about cool sculpting and that it helps that area, but really they have loose skin there, and then the cool sculpting won't help them much at all. But she's a great candidate for cool sculpting. And then sometimes even once we get rid of most of it with the cool sculpting, we can do injections of Kybella, which is another fat dissolver that's non-invasive, just injecting chemical that will dissolve fat cells, and that'll allow for some fine-tuning for areas that we didn't quite get with the cool mini. And again, a permanent result with Kybella as well for fat destruction under the chin.
And I want to add in that what I also think I had in my picture is a little bit of filler
In the jawline.
to kind of accentuate, because right now she doesn't really have much of a jawline. And so that's another thing on both. I mean, you do it too, but derm side anyway. So okay. So Dr. Ellstrom, let's talk about what you might do for this lovely young lady.
Yeah. So I mean, similar to for the stomach one, I mean, one of the most important things to address in a patient like this is like, what's their skin quality? Do they have significant elasticity? Is it something that's going to snap back if we were to take some volume out? So assuming she has good skin quality, which in the photo she looks like she does, we'd want to look and see, is this mostly fat that's kind of above the muscle of the neck, the platysma? If you got a good pinch of stuff here, that's something we could address with liposuction, which is really the simplest way to address this. Typically for liposuction, I'd make one like 2.5 millimeter little poke right here and kind of in the crease of the chin, and through that we can contour all this stuff. Additionally, I can do 2 little pokes right behind the ear up here that can allow me to really focus on getting some of the fat around the angle of the jaw to really contour all that in. And I'd say that's an advantage of liposuction over cool sculpting and other things, because I can come up a little bit higher to get some fat in here to get a sculpt and contour the jaw a bit more. Because everyone, I mean, especially right now in social media, they're looking to get like a little bit of shadowing and other stuff to help define the jaw, which we can do without having to do additional fillers sometimes.
Does anyone have any questions about this?
And I will say that's a one-time procedure. Takes an hour. We can often do it just in the office under a little sedation, like a Valium or something. It's usually pretty comfortable. You wear a little compression garment for 2 weeks and then all done.
Nothing to it but to
Nothing
do
to
it.
it. Yeah.
And can you use that fat for anything?
Yeah, I mean, if we have the fat, we can put it somewhere else if you want to. It's usually not a massive volume, but you could put it back into the face. So you could, use it as a permanent filler in the folds, in the hands, or other places where you just need a little bit. Hands is actually a good spot to put it because you only need, like 10 cc's or so of fat, and you can really restore some of the volume loss there.
So we kill fat cells, can't do anything with them, but
Yeah, I can put them to work.
Does anyone have any questions? Nothing? Really? Okay. I'm surprised. Does anybody want to see my before picture and after picture?
I do.
I'm kind of impressed,
Very nice.
right? I think,
Yeah,
am I wearing the
that
same
angle.
earrings? No, they're a little different. Yeah, so that was a little bit of cool sculpting, a little bit of Kybella, and I think a little bit of filler. I'm so glad I work here. All right. Next picture I have is just, these lovely, maybe generational, women. So we got a lot going on here. And Dr. Ellstrom's like, ooh, what are we talking about now? I wanted to kind of address just regular facial aging and laxity. So obviously, this young one over here probably doesn't need too much help with anything. Maybe, these days everybody's doing a little lip, right? What else? What would you?
I wouldn't put lip filler on her. I think
she's
she
pretty
has
plump.
lovely lips. She might have already had a little help with her lips. I might do some IPL. She's got a lot of freckles and sunspots, sort of, that I would probably do IPL and a light fractionated resurfacing to try to just sort of brighten and even the skin. But I like the structure. I mean, I wouldn't give her I wouldn't give her filler or probably very little Botox. It would be more evening the skin and the skin quality itself.
Okay, she should just be wearing sunscreen.
She's a redhead.
She's a redhead. Okay, middle picture. Did you have anything to comment on this
No,
youngster?
I mean, unless she came of a specific issue or complaint, I mean, there's nothing I'd,
A Brazilian butt lift?
If she was a good candidate, it was, if that's what she was wanting, possibly. But I mean, again, like there's nothing I'd specifically go after in here.
Okay. The nice, lovely lady in the middle.
The nice, lovely lady in the middle.
Do we want to go with Dr. McNeill first and then Dr. Ellstrom?
Whatever you'd want to hear from.
Okay.
I mean, so she's got some volume loss. She could also use some resurfacing. She doesn't have the brown spots. Her skin tone is very even, but we've got a lot of little fine lines around the mouth and around the eyes. So I would definitely do a fractionated resurfacing and some filler in her cheeks and around her nasolabial folds.
Can I see that?
It's really funny, you guys, because when I was, early this week, I think Monday, I was like trying to find pictures that anybody had anything wrong in. And it's like, was very challenging to find pictures of anyone who had problems. They're all like before after pictures and not like just the before picture. And then I did this search for I was like, okay, well maybe I need to look for grandma in her 50s, right? And all of those ones were like perfect.
Supermodels.
Cindy
Crawford
nobody
in
wants
her
their
50s.
picture taken, or they're like 80 and don't have any teeth. And I was like, well, that's probably not our demographic that's watching our Instagram live video. So,
All right, so it's kind of hard to see in this photo because the lighting is a little blown out.
see, he's such a plastic surgeon.
Well, you have to have good lighting so you can get good assessment of patients. There's a lot of deception in lighting. But in this one, it's kind of hard to see what's going on with her jowls. You can see she's clearly lost some volume in her mid-face here and around her nasolabial fold. She's got some crepiness around the eyelids. It's hard to kind of evaluate her jowl. But, I mean...
So does she need a facelift?
It'd be a very soft call on this one. You'd really have to see, what she looks like in person. I mean, looking at her photo, it looks like she probably has some neck laxity in here. But again, the lighting is kind of nebulous and low resolution picture.
It would really matter like what she came in complaining about, right? Like, you're not going to recommend a facelift if she's saying that, she has loss of lip volume or something. Like, she's obviously a beautiful woman and it doesn't need anything.
I don't try to poke holes.
Right. So, again, maybe not the best example, but you could. She's right on that line. And let's talk real quickly about...
But she could benefit from some resurfacing
I agree.
and filler.
I mean, I think that's a good way to start. And it's something that you can do earlier on without having to do any drastic change.
Goes back to what we were talking about in our last live event, which, by the way, if you're enjoying this and you missed any of the other ones, you can go back and watch them, although you won't be able to ask questions. But you could probably direct message me and I might answer. So, but this nice lady, you could do some preventative work. Like, it's not... when you get to be this point.
I mean, she has some volume loss in her face, so like she's looking a little hollow in here and in her nasolabial folds. So, some of that fat we were talking about earlier, that's something that you could put into those areas as a permanent volume replacement, instead of a filler.
Something I'm also seeing is like, so you see her, she's got kind of the upward, lifted lips, and this one kind of has a little bit of the downward facing lips, which can sort of sometimes make them look like they're not quite as happy.
You mean this line right in here?
Yeah.
Yeah.
What would you do for that?
Surgically? I mean, usually I like to do that with fillers. But volume replacement, you could do some fat or a little bit of filler as an option. I mean, we'll get some correction of that with a facelift too. But
Dr. McNeill?
Yeah, I always use Reviness in these patients. I use Reviness peri-orally, so I'll go in on
What's
the side.
Reviness for the
Reviness
people who
is a
don't
filler,
know?
or hyaluronic acid filler. You can put a little bit, it's quite versatile, so you can use it in the lips itself, but also peri-orally. You can go in with a cannula at the side of, just lateral to the angle, each angle of the mouth, and then you can fill above and below, and it really just sort of supports the corners of the mouth. Allows them to turn up a little bit and give like just a tad of volume to the lips, and it looks really pretty. I probably did 4 patients with that today. Just one syringe, when it's just a little bit of volume loss around the corners of the mouth. It looks really pretty.
And I also want to just say, I know we're talking kind of battle of the derm and the plastics, but Dr. Ellstrom also does do filler, so you can see him and he doesn't have to cut you.
that's true. It's not always scary.
Okay, so now...
He tries to talk you into it.
But he tries... he might.
I never have a hard sell. I just tell you what's up.
No, that's true. You really don't. This nice, lovely lady here. First, let's go with you, Dr. McNeill. Like, what can we do for her?
Well, she's very cute.
I agree.
I would see what's bothering her. I mean, I love resurfacing. I love fractionated CO2. She's certainly a patient who could benefit from fractionated CO2. It would smooth her etched in lines. It would just give her skin more glow, more life, erase little sunspots and things like that. Generally, with a patient like this who doesn't want sort of major surgery, that's going to be the best way to give them sort of a younger look overall, by just giving them, a sort of a more natural looking glowing skin, more even skin. But I wouldn't do a lot of filler or, maybe a little bit of Botox here, but that's it.
And the reason being would just be like it would just take too much. It would be too hard to regain that volume, right?
I agree. It would
maybe too heavy.
It would take a lot of filler in order to lift sort of all the heaviness that she has here, and it would take so much filler that it would look unnatural. We would have to put so much in her cheeks that her cheeks would not have sort of the right proportions and dimensions. So I think it would just be a waste of her time, money, energy, everything to get filler. whereas we could just give her a nice glow and more youthful look with laser resurfacing.
I like that. Dr. Ellstrom, what can you do for this lovely, lovely lady?
Now, I agree with that approach. I think, putting a lot of filler in with the idea to try and efface every little crease and wrinkle, she'll just end up looking really heavy in her face. And I mean, that's really the thing I try and avoid a lot, in any type of, surgical procedure I'm doing on the face, is to not create heaviness or, because if you look at these photos, you see this youthful face, it's kind of more triangular, then, a little bit more bottom weighted and like a lot heavier down here. So we really want to try and lift and correct that, assuming she wanted like a big surgical thing. So this would actually be like a facelift, neck lift type of patient, and then probably blepharoplasty surgery to get rid of all these lines in the face. She also has a fair amount of volume loss in here, but this is actually a patient that would be good for transferring some fat from somewhere else in her body, so it's your own tissue and it looks and moves and feels more like your own tissue versus a inanimate filler.
Probably not a Brazilian butt lift.
Probably not in her.
No.
But I think actually resurfacing is a really good idea in this patient, potentially before even doing a facelift, just to help improve her skin quality so it has more elasticity and handles a little bit better. So I like to do that ahead of time for certain patients, kind of depending how they look.
So that's interesting. So you're saying, and you mentioned that earlier too, and I just want to touch on it. You're saying that if somebody does CO2 prior to surgery, it can actually make their skin healthier for the surgery.
Yeah.
That's pretty cool.
So, I mean, because I'm looking at, everything collectively, because I could be a great tailor and make a really good suit, but if it's really bad fabric, then it still looks, not best.
It's not Gucci.
So, right. So you want to do, resurfacing and other things to try and make the fabric better to get you more your Gucci suit material so that you can make a really, finely tuned and cut suit. That's how I kind of look at it. So, even though we're back and forth, there's a lot of synergy.
Right. I agree. You guys, you make a pretty good team.
Aww.
Oh. I do want to say we're sitting awfully closely together, unmasked.
Crazy.
We have all been vaccinated.
It's legal.
The CDC says we can be unmasked together. Yee. Anyway, are there any questions? Really? Is anyone watching? Is there anyone out there?
Yes.
There are people out there. We think we're very entertaining.
Yeah. I mean, I don't know.
Okay, so I think we can wrap this up. I will let you know that we're going to continue on. There's going to be another live show, Kicking It with Kerry, my special guest next week, next Tuesday. Drum roll, please. Dr. Lamer will be in the house.
All right.
Yes, we'll be talking about, we were supposed to talk about it last week, but there's a little scheduling, baby daycare situation snafu. So we're going to get back on track, and Tuesday at 5:30, this coming Tuesday, will be maybe right here. I kind of like this little setup. With Dr. Lamer, we'll be discussing how your diet can help improve some common skin problems, from acne to eczema to what else, Dr. McNeill?
I don't know, but I could tell you it's one of the solutions is going to be whole food, plant-based diet.
I got a feeling. So Kate is my trusty camera woman here, and she's letting me know that somebody has a question about microneedling.
Yes. I'm giving clarification on the exact question. They said, what about microneedling? Can it fix the problem? I guess assuming we're talking about...
This old lady at the end? No. Sorry. Ship has sailed. Pigment? No. It's not going to work on pigment. I'm saying no. Microneedling would not be the solution for any of these. She might get some brightening from microneedling, but it's not going to give...
Really need to see like the texture of the skin quality. So you need a bit higher resolution photos so we can take a peek at that.
Look at me. I have the two master professionals, and I'm like, no. So
I think microneedling predominantly helps with real fine lines, early fine lines. Helps with mild sort of ice pick acne scars, like narrow acne scars, and just sort of all over skin brightening. But I agree. It's not really going to help like those pigment, like lentiginase or skin laxity, like in the middle patient. So none of these are really someone I would jump to microneedling.
Right. So we do a lot of microneedling in the office. I literally just ordered a bunch of the tips. We don't reuse those. So, and I was like, oh my gosh, like we went through that order so quickly. So we do a lot of it. Generally, it's like maybe a little younger patient, would you say?
Generally like, well, 20. I mean, it depends on what it's for. If it's for acne scars, it can be a 16-year-old. But up until 30s or early 40s, but just for sort of little fine lines and skin brightening overall, anti-aging can be very helpful. But it doesn't tighten skin, and I think that's what we were looking for in these patients. And it doesn't really remove sunspots either. It's more for skin brightening and fine lines.
All right.
She said thank you, and there's no other questions.
You're so very welcome. I hope you will join us next week on Tuesday with Dr. Lamer. And then, coming down the line, we're going to be talking with Dr. Llewellyn pretty soon about hair loss. It's a very common issue that we'll touch base on. And then in the coming weeks, I'd like to kind of get some of our vendors in and reps to kind of talk one-on-one with them about their product lines. So please, let me know. I love hearing from you guys. There has been like some really great feedback, and it's helpful for me to kind of guide the next show choices. So thanks again for joining us. We really appreciate you as patients, and we look forward to seeing you next time on Kicking It with Kerry.